So I would like to invite our next speaker, Dr. Rachel Tams from Oxford.
Hi, and thank you. Just want to start by saying I'm really delighted to be here this afternoon, and my presentation's around what is known about children's psychological support needs when a parent has MND and the available services that are out there, or what a good intervention might look like for children. And I can hold my hands up now and kind of say not very much, basically, and I could keep this really short, but I have still managed to fill 15 slides of some of our reflections and thoughts, so hope you'll find it helpful. So have no disclosures, but just to give you some context. So myself and my colleague Audrey Daisley, who can't be here today, but this is very much her presentation as well, are both jobbing clinical neuropsychologists working for the NHS in Oxford. So we work in a neuro rehab service supporting people with a range of neurological conditions, including MND. And Audrey leads on a particular bit of the service, which is specifically family support service. So she will work with relatives and children who are living with a neurological condition in the family. And the outcomes for today are to have increased awareness of the issues affecting children who are living with MND in the family, to kickstart thinking what good support might look like, and to highlight the importance of further research and the development of services and networking in this area. So as I go through, I think what I'll be highlighting is that there isn't a lot out there written in the scientific literature, but I want to stress that that doesn't mean that there aren't pockets of really good practice and innovation going on, and I guess that's one of the reasons why we wanted to present today. You know, it's really good to find out what's happening out there and what's maybe not being captured in the hard literature. So we'd really stress the importance of networking and letting us know if you've got a really good model, really good services for children in your area. So in terms of challenges to children, we know that MND presents family members with a unique set of adjustment challenges, and we know more about how adult relatives are affected. There's across a range of neurological conditions, quite a lot is written around spouses, carers, adult relatives' experiences. And we know that MND typically results in profound and complicated losses for the person and the family around them, and that there is a bit of a reciprocal relationship in that when a family member isn't doing as well with their psychological adjustment, it can have a big impact on the person with the condition and vice versa. So it's really important to consider family members' needs in their own right, but also in terms of how it's going to impact on the person with MND's well-being as well. So we know that adult relatives of people with MND typically present with increased levels of psychological distress, so increased rates of anxiety and depression. But much less is known about how children are affected, and there is very little literature out there on this. We know little about how having a close family member impacts on children, how children cope, or how best to be supported. So we recognise, if we look at the wider literature of children who have a parent or close relative with a neurological illness, that they are more vulnerable to psychological distress. And also from the wider health literature as well, when we look at conditions like cancer, we know the group of children are vulnerable. But when we look at the condition-specific literature for MND, there is very little that is out there. So we just found a couple of studies, and it may be that we're missing things, so do say, either do say at the end or email us if we're missing any research studies that you're aware of. But we found the first one is a qualitative study, so a small number of children. So I think there's a sample of 7 older children who were caring for a parent with MND, and they reported that they lacked information about their parents' illness, particularly around diagnosis and prognosis, and particular issues that they flagged up were around coping with changing family roles and the impacts of their care responsibilities on education and social life. And then another study, Calvo and colleagues, was with a larger group, so comparing 23 children who had a parent with ALS to children with healthy parents, and they found that children were at increased risk of emotional and behavioural difficulties. So they found difficulties in terms of internalising symptoms like anxiety, depression, withdrawal, and those findings are generally consistent with the wider neuro and health research. And also, I mean, it sounds like stating the obvious, but the International Resiliency Project, which was a large international study of children, just highlighted that death of a parent is rated by children themselves as the greatest stressor that they can encounter in childhood. So does it fit clinically? Say yes, it often feels as though children are the hidden victims and they're overlooked in service provision. And because there's so little research out there on children's psychological needs, there's not much guidance on how best to support them. Key issues that seem to come up in the literature and from clinical experience are around understanding the diagnosis, its causes and what that means, understanding and coping with changes and gradual losses over time, restriction of life experiences, fearing how others around them might respond, so thinking about how friends may be when their relative dies, and conflicting emotional responses and having little life experience to draw on. And on top of that, you've obviously got the child's developmental age and their understanding of things like the concept of death and dying. And that is happening while parents themselves are struggling with all of the issues around uncertainty, grief, managing day-to-day changes, trying to live well while managing the deterioration and preparing for the future. So child-focused interventions, I've already said there's very little out there. We actually couldn't find anything in a systematic review that we carried out a few years ago, and that was on psychological interventions across a range of neurological conditions, not just MND, but we couldn't find any published studies. And as I said, that doesn't mean that there's not really good work out there. So we know of things like Hope Loves Company in America, which seems to be a really valued resource for families. So they offer interventions like counselling and camp-style programs, so with real emphasis on social connections and children coming together. And we're unaware of anything like that in the UK, but it doesn't mean it's not happening. And I know from a conversation I had earlier this morning, I've heard that there's an MND nurse who's running quite an informal social group for children in Milton Keynes. So I think there are things that are happening and that families are valuing, but maybe we're not all aware of it or they're not being written up. So NICE guidelines in 2016 place focus on signposting families to help. So they say it's really important that we recognise the needs of all family members, and then we refer them on, or they're signposted on for psychological support or respite. But the question is where and what, what is available, what does good support look like? So these are the sort of things that we thought might be available for families. So we know there are fantastic MND Association resources, and we were shown some of those earlier. So there are great resources for children and in lots of different formats. There are the MND care centres. We wonder if there's variation in what is offered in terms of family and children's support. In Oxford, so within our centre at the OCE, so that's an NHS service, we do offer family support, but we have very long waiting times, and the feedback we often get from families and from professionals is that as a service we're just not responsive enough and we can't offer enough support in a timely way. Hospice and palliative care services, I think, are often involved in providing support to children. And then there are a range of specific child bereavement services, so things like Winston's Wish. We have Seesaw in Oxford. There's the Children's Bereavement Network across the UK. So there are lots of specialist bereavement services for children offering resources and support, some groups, but again, it may be patchy across different areas, and young carers agencies. So generally our impression is that there are a few dedicated family support services or intervention programmes that are offered within the NHS. And the next question we thought of are what are the barriers to this work? And this is a little bit tentative because we don't know, and these ideas are just coming from other work we've done with other neurological conditions. So Audrey and I ran a couple of large surveys several years ago now, but national surveys of MS services, and then there was one that was also around acquired brain injury services. So we were just contacting professionals to ask them about their experience of working with children, what they were offering, what their feelings were about working with children when a relative had a neurological condition. So with the MS survey, we were mainly asking MS nurses. And with the brain injury survey, it was a whole range of neuro-rehab professionals. And what came out of those was that everybody was very favourable about supporting children and saw it as an important area, but the majority were not doing this, other than maybe providing information. And the main reasons were contextual, so things like lack of support, so lack of support within the workplace, hit and resistance from parents, and that natural tendency that some parents had about protecting their children and not wanting to upset them. Parents fearing that they might be seen as not coping if they raised issues with the health professional, or people just not being aware of what services were out there. And then there were also a whole range of practical issues, so things like lack of time, money, access to training and supervision, and then personal issues like anxiety and feeling it was out of their role. Based on our experience, we would say what children need is complex, that the way children cope with family illness is complex and it's mediated by a number of factors. Age-appropriate information is hugely important to help them make sense of it, but we also know it's important to target other issues that are crucial in building resilience, emotional resilience. And the key features there are around connection, so meeting others and having that kind of support, and looking at enhancing coping and the strategies that people use. Skip that. And one example of an intervention that we've just been thinking about is group intervention for children who have a parent with MND. We run a very similar group for children with MS. That is really well received, and it emphasises those resiliency building ideas. So this idea of bringing together a group of children in a similar situation, providing them with info, but also looking at the things that we know are important for resilience. So looking at their existing resources and strengths and role models, and trying to send them away with a bit of a toolkit of things that they can try when they feel the going gets tough. So we just wondered if that could be adapted for children with MND, and we're not sure. You know, we think there are specific issues and differences and difficulties, and one of the key things is around possibly encountering more reluctance from parents, a wish to protect children from the idea of death if they haven't been having those conversations. It definitely wouldn't be the right forum for children to be learning about the prognosis in, so that would need really careful consideration. But would there be a benefit of bringing children together and running some kind of programme where they can share ideas and experiences and build up their skills? We'd also need to consider things like follow-up and bereavement support, what it might be like for the facilitators in terms of their own emotional reactions and support needs. So it's just an idea at the moment. We've met with MND colleagues in Oxford and the MND Association, and we were thinking about a research grant to look at it properly and evaluate it properly. But I think we've stopped, and we're just thinking at the moment if that's the right way to go, or if we should do more general research first. So we think good child support would target those processes known to be important in enhancing resilience, and it would be strengths focused, focusing on what's around the child and what might help them at times of difficulty, and would be available through the whole journey of the illness, so from the point of diagnosis through to bereavement and post-bereavement support, and support the parents and other family members on how best to support children. I think that's a really big issue. So parents often tell us they have the information, they know about the resources for children, but it's still very difficult to have those conversations, and it's around how best we support them and skill them up to be able to do that. So what next? We just feel that a lot more research is needed in this area to guide all of our work to ensure it's based on good practice and the child's lived experience. So we're just looking at funding to carry out research into identifying information and support needs, and just build on that very limited evidence base that's out there. We've also been thinking about surveying professionals' experiences and attitudes towards supporting children. So like we did with those other conditions, but thinking of something that's much more MND specific. We'd like to find out what else is out there, what sort of models people are using, if they're running groups or if they're referring on to really good palliative care services. It'd be great to know what works. And maybe consolidate that link with Hope Loves Company in the US. It'd be really nice to find out more about that and how that works, and maybe something similar could happen in the UK. So in summary, we just wanted to stress that child relatives are really important in their own right, and they're potentially a high-risk group who are vulnerable to difficulties. And I think NHS services generally are not meeting their needs, or they're slow to address the needs of children. But potentially we can see positive outcomes, positive personal growth. So literature in other areas of neurological illness has also shown the positive growth that children can report through supporting a parent, living with a parent through the journey of their illness. So the challenge for us really is just to increase children's visibility in service provision, literature and research and clinical practice. Okay, so thank you for listening.
Thank you. We do have a question. There's a lady with her hand up just in the middle on the fourth row back.
Hi, thank you very much for that. I'm Karen. I'm a physiotherapist and also a researcher in Australia. and I've just finished a PhD on exploring the experiences of families living with younger onset dementia. And what you've just said is just exactly what is happening with that group. And I think it's not just disease specific, I think it's very general all over, all diagnostic groups.
Yeah.
I just wondered how you get over the age issue of actually speaking to the children, because that's a big, big thing. And the health professionals I've talked to have called the parents the gatekeepers.
Yeah.
And the parents struggle, they don't want to upset the children. They've already got emotional baggage, was what one of the parents said. I don't want to add to their emotional baggage. And there doesn't seem to be services where the children can actually go to anyway. So they think it's a waste, and the children are really, really psychologically very distressed.
Yeah.
So I just wondered how those young children that are still, have to get parents' consent to go anywhere, how do you overcome that?
It is really, really difficult, because without the parents' consent, can't do anything. So, and I guess as a psychologist in our service, we tend to see the children where there are real issues. It's kind of, and that's why I think we like the idea of a group intervention, which is much more preventative and about skilling up all children. But in terms of trying to get parents on board, I think we just go down the line of really trying to normalise it and just say, this is what we know generally helps children. Even if you're not talking about it as a family, they'll be picking things up, they'll be hearing things, and what they're thinking and their kind of conceptions about the illness you'd be really surprised. So we know it helps for them to have the information. But I think if you hit complete resistance of parents, it's really difficult. I think it's a case of talking it through, giving them the information, and just coming back to it, checking in, like having almost like a family checkup when you see them, and just say, do you feel ready, or do you feel it's a good time to talk this through? But really hard, and it's really understandable as well. As you said, they're going through so much, and there's no clear answer on when's the best time and what to say. So.
And
Okay, thank you.
Professionals often, do seem to have just that concept that they're working with adults as well, so they struggle with children.
Can you say that again, sorry?
A lot of the health professionals think that they're going into that job just to work with adults and struggle with the concept of working with children.
It is hard, and it is, you think, what's my role? And so that comes up a lot, like with the surveys we've done before. And it is really interesting, we just ask people, as a kind of jobbing physio, say, going into someone's house, if there's a child there, do you explain why you're there and who you are, what your role is? And again, people are guided by the parents, but it is difficult to. It's so complicated supporting the adult who is your patient, but then there is this whole family system around them. So,
Thank you. We've got time for just one more question. Gentleman down here.
Thank you. And I wonder if we should do more instead of getting into researching this. Why don't we
just do
start?
it? Yeah.
Yeah, and hope Love's company is a great thing, and getting the kids together solves a lot of these problems. And we are in Iceland, we took a group from Hope Love's company, and they just spent time being themselves.
Yeah.
And that's very important.
Yeah, I think you raised a really good point. It's like when I was saying about our group and like applying for grants, it delays the whole process. So I think there is real value of going for things as well. I think the point I'd make with the soft literature is if you're going for it, it's just really helpful then for professionals to write that up. It doesn't have to be a big study, but just to have it out there somewhere so that people know that there's a particular group or, you know, that people are finding benefit in it is really helpful just to build the networks and build that evidence base. So thank you.
Thank you very much, Rachel. We do
Thank
need to
you.
move on to the next
Cheers.
speaker now.
Thank
Thanks
you.
a lot.